Back students. So yesterday's class, I have given you that review of menstrual cycle, isn't it? So we are discussing already. I have told you that we are discussing gynecological nursing. In that second unit is puberty. So we have seen the what is sexual organs in the female and what is definition and what is menstrual cycle. Now we'll see the problem related to the menstrual cycle, that is premenstrual syndrome. So in the definition, in the word itself, it is having that pre means before. Menstrual means before getting your periods, isn't it? Before getting your period. Syndrome, what is syndrome? Group of problems, and that means you are having some problem, health problems. A lot of health issues is known as syndrome. A collection, a group of, like, you will get at the same time, you will get headache, weakness, tiredness, so stomach pain, like that. A group of symptoms, a group of disorders, a group of thing is known as problems, is known as syndrome. Keep it in your mind. Syndrome is not related to one condition, it has more than one condition. Okay, so premenstrual, that means before getting your periods, some people will get the problems, health problems, that is known as when they will get ante during some period. We already have seen in the menstrual cycle, no, that 8 first to 14 days, 7 to 14 days is one cycle, and 14 to 28 days is ovarian cycle and the uterine cycle. So in these type of cycles, anytime some people will get a health problems, either they may be in the uterine or they may be in the ovarian. Now we'll see the definition part. So premenstrual syndrome is a condition that affects a human emotions, physical health and behavior during certain days of your menstrual cycle, generally just before her menses. Some people will have mood swings, tiredness and restlessness. Some people, without knowing, we will shout on other people. Sometimes, no, is a big issue also, will take it in a positive way, but in some ways, where we are facing this premenstrual problem, no, that time even a small thing also, it will be seen in a it will be conveyed like a big one, because of our emotional imbalance, physical imbalance, emotional imbalance, and also some behavior also will be changes during certain periods of your menstrual cycle. Undergoing the menstrual cycle phase, no, that time you will have this problem before getting your periods. It is a very common condition. It is symptoms affects up to 80% of menstruating women. It is a very common. Why? Because, no, these all for getting your menstrual cycle every month, the hormone should work, isn't it? If 14 day, if you see that cycle, so some hormones will be increasing, some hormones will be decreasing, isn't it, or not? So this what is imbalance, this is, some is increasing, some is decreasing, this imbalance will causes your disturbances in your health status. So it is a very common condition. Most of the women who are having menstrual cycle, no, they will had this thing, 85%. So it is must impair some aspect of your life for your doctor to diagnose you. Premenstrual symptoms starts 5 to 11 days before your menstruation and typically go away once menstruation begins. The cause of premenstrual syndrome is not unknown. Mostly, I think mostly it is because I think that it is because of your, because of our hormonal imbalance. Okay, that is, some are increasing, some are decreasing. So that may be one of the reason, but exact reason is unknown. And then what are the causes for premenstrual syndrome? The causes, coming to the causes of premenstrual syndrome, risk factors, because already we have told that what is cause we don't know. So when we don't know the reason, so that time we may expect some of the things may get. Okay, risk factors ante we may get because of these problems. What is that? First thing is depression, history of depression. When we have a mood disorders or any personality disorders or any depressions, that easily we will be getting our go into again one more bad mood, isn't it or not? Already if you are in depression, so again this hormonal imbalance and something is going in your physical state, then automatically you will be disturbed. And next thing is a family history. Already if your family, your mother, your grandparents, or your mostly mother will have this, no, you will get that. A family history of depression, any psychiatric conditions you can write. And domestic violence. So whenever we feel stress, that time not only this menstrual premenstrual syndrome, whenever you feel stress also you feel so many health issues, isn't it? Headache, restlessness, fatigue, sometimes you will feel body pains, isn't it or not? So domestic violence, whenever you are having your domestic violence, is nothing but, see, so many women are facing problems with husbands and they are beating, they got beaten up by the husbands and in-laws, isn't it? So that is come, so they will scold and they will use bad words, and they, because this wife, no, she was bearing all these things already, her mind is filled with all the stressor, so that's why it may be the reason for premenstrual syndrome. And substance abuse. So substance abuse, for example, this alcohol or cocaine, ganjai, okay, you all know all some of the things, tobacco. So when we are using some, nowadays women are also what is that, they are in modern culture, and they are for, they are taking all things ante where, what women nowadays are thinking, so whoever is taking alcohol or whoever is having these habits, no, they are rich, so they have some status in the society. So because of this reason, nowadays so many women are also addicted to the drug abuses. So that may be the reason for premenstrual syndrome. And physical trauma, whenever you are having a physical trauma, that time also physical trauma in the sense any injury to your body like fracture or falling down, or any injury to the body, any operation to your body, that time also it may leads to the premenstrual syndrome. Emotional trauma, whenever you are emotionally broken out, that someone you have lost or something you did not get, and you are crying inside, that time also you can get the premenstrual syndrome. And others includes dysmenorrhea, so who are having some difficulty of menstruations like hormonal PCODs, okay, that we will see in later classes also. So next thing is major depressive disorders like mania, schizophrenia, that also we can see, depression. And seasonal affective disorders, and some of the seasonals also will get some disorders, no, that we can continue. And general anxiety disorder, schizophrenia, already I told you. And what are the till now we have seen the risk factors for the premenstrual syndrome. Coming to the symptoms of premenstrual syndrome, the symptoms includes abdominal bloating. So what is abdominal bloating? Bloating is nothing but feeling heaviness in the stomach. Okay. So something is there in the stomach like gas feeling. So that will be seen, and abdominal pain will be seen, sore breast. And sometimes your breast will be having pain. You don't know that. That means tingling sensation. That is because of this PMS. And acne, you all know that basically if you have get pimples, no, then you will tell that, oh, my period will come, I am getting pimple. So that is one of the symptom. And food cravings, especially sweets, you want to eat more oily sweety food anmata. And next thing is constipation you will have, otherwise diarrhea you will have. Headache, sensitivity to light or sound, sometimes, no, because of our mood we can't see the light, sometimes we can't hear the sound, isn't it? So anyone is shouting, no, you will get irritation because of that sound. Or if you are in light, no, someone put light, no, that time also you'll get irritation. Why? These all are because of your hormonal imbalance. And fatigue. And emotional and behavioral signs and symptoms, we can see tension or anxiety. You may have tension, anxiety, mood depression, crying spells, and you want to cry, so without any you will find reason to cry, so that is a main thing. And mood swings and irritability, anger, appetite changes, I told you already, more appetite will be there. And also that appetite also will be more on sweets. And trouble falling asleep, social withdrawal, so you don't want to mingle with other people, just you want to be isolate in your room and you want to take rest, so that is known as social withdrawal. You don't want to go and mingle with your friends or with your family. And Poor concentration. You can't concentrate on anyone, either studies or playing or anything. You cannot concentrate. And change in libido. And next thing is, your doctor must also rule out the other causes such as anemia sometimes is also causing for PMS, and endometriosis, that is the uterus. No, you have seen the endometrial layer. So if any infection to that layer, so that may leads to the PMS, thyroid diseases, irritable bowel syndrome, fatigue syndrome, and connective tissues or any rheumatic diseases when you are having pelvic examination. So, see, these all are the symptoms we will get. Not, see, it is not a rule that every woman will get all these symptoms. Some may get some symptoms. So, what can be the treatment? So, based upon the symptoms, you will get the treatment, because we can't take the tablets for these symptoms, because these all are very normal one, which is with small changes with your environment you can overcome with this problem. There is no need of that much treatment or anything. Okay, so what can be the uh, managing part of the treatment? We can't tell the treatment part. So managing part of the symptoms, that is easing of the symptoms. So how we can get, see, we cannot get rid of the symptoms because it has to come. సో అక్కడ నుంచి how it has to be decreases. మనం చేయాల్సింది ఏంటంటే it we want to decrease it. So how we can decrease the symptoms like pain or anything? The first thing is, first of all, when you have bloating, so that time you have to drink more water into your stomach. If again space is there, again the air will be filled more, so again you will feel more bloating. So that's why, in order to compress your gas in your stomach, you have to fill with the water and eat a balanced diet, and improve your healthy diet. Okay, you have to eat healthy diet, and your energy level, fruits, vegetables, everything you have to be increases on, especially before your period, 10 days before your period. And coming to your thing, so you have to decrease your sugar content, salt content, caffeine, alcohol, everything you have to be decreased. And taking supplements such as folic acid, vitamin B6, calcium, and magnesium to reduce the, sometimes supplements will help you to decrease the symptoms. And taking vitamin D also is very much important to reduce the symptoms. Either you can take it in a tablet form, or either you can go and stand in the sunlight at least for half an hour daily. Every woman needs calcium or vitamin D for your bone strength and for your immunity. So you can go and walk for half an hour in a sunlight. Sleeping 8 hours should be there. So see, most of the women will not sleep properly. That's why they are not only women, yeah, girls also, they will not sleep properly, and improper timings will be there. 12 o'clock they will sleep, 7 o'clock they will wake up, and 2 or sometimes 2 o'clock they will sleep. Simply they will husk and they will see mobiles, and they will pass the time. But the thing is, the timing should be there. So why we call it as night? So we have to sleep. So 8 to, at least 8 to 6, or 9 to 6, at least 10. You have to sleep at 10 and you have to wake up by 6 o'clock. At least 8 hours sleep should be there. That too in a regular intervals of time. So daily you have to put one time for sleeping pattern, so that you can have a healthy thing. And exercising also should be there to decrease bloating. Not only for bloating, yeah, exercises and your what is that, meditation, everything will be decreases your stress in your body, so that your body will have some calmness. So automatically it will reduces your stress levels in the body, depression levels in the body. And reduce stress such as through exercising, reading books. So whatever you like, you do that 10 days. No, whatever you like, your hobby, you just follow that hobby before your, when you know the date of your menstrual cycle, so before 10 days also. Otherwise, it's, if it possible, no, daily you take your hobby, daily you do that, so that you will reduce your stress. Going to cognitive behavioral therapy, it is going to a psychiatrist to have a behavioral therapy to get these things. So this is about the premenstrual syndrome. So This is a small condition they have given you separately. And next thing in this unit, one more topic it is there, that is disorders of menstruation. So again, they have given you like dysmenorrhea, cryptomenorrhea, dysfunctional uterine bleeding. Three topics are there that I will be taking in the next class. So go through this topic, yeah, don't, and write notes whenever you will come to college. Whenever you are coming to college, you have to bring these notes. And also after finishing this unit, so you have to read and come, and we will keep exam on that unit immediately after you are coming. So go through my class, write the notes and read it properly. Okay, see you guys.